At this point, I would like to bring your view back to the United States where the story began, and back to Hawaii, to the major production of the papaya in the United States. Remember the situation in 1994 when the infestation of the wing spot virus devastated the papaya production. In contrast, 10 years later, in 2004, the papaya farmers have reclaimed their lands for papaya production. You might also be interested in the world at large. Currently, there are 17 countries which have approved transgenic crops. Looking especially at the number of the adoption rate, it has been increasing continuously since 1995 when the first transgenic crop were introduced. Just between the year 2003 and 2004, there was an increase of about 20% on the adoption rate, and the overall adoption rate appears almost exponential. Well, while many parts of the world are considering and taking actions to approve the transgenic crops, the papaya industry of Hawaii has been trying to serve a non-transgenic market as well. Despite serious attempts to grow non-transgenic papaya for particular markets, they have been rather unsuccessful. Like you can see from this slide, on the front field, these are the non-transgenic papaya, which hardly survive the virus infection, whereas those in the back, these are the transgenic papaya, which are fruiting and waiting to be harvested. Again, this slide shows you just another picture from different fields, but with a common situation. The farmers try to grow non-transgenic papayas on the left, but again, these fields do not look promising. On the right, these are the transgenic papaya waiting for the harvest. To recap the story of transgenic Thai papaya, I have no doubt that Thailand is on its way to the same success like in the United States. Apparently, Thailand has to follow its own roadmap to achieving the same goal. We have been using the success of the transgenic papaya in the US as our motivation. However, we must adapt the process according to the political, cultural, and ethical background of the Thai people. The regulatory agencies have to consider between the risk of not using this technology and the actual risk of using it. It is imperative for initiating new biotechnological applications that the Thai government be able to base their decision on qualified risk assessment to get information ready for the risk communication and risk management. Well, although papaya is not a major agricultural export product of Thailand, it is more than just food. Papaya appears in our songs, dances, and many aspects of Thai culture. Growing papaya provides Thai families with work opportunity, income, and not least important, with pride in themselves. With the prevalence of the wing spot virus, transgenic papaya is seen as a promising solution. And this concludes my presentation. Thank you very much for your consideration.
Thank you, Dr. Michelle. Can I just ask, we're coming up, when was papaya introduced to Thailand?
The first plant ever?
Yeah.
200 years ago.
200 years ago.
200 years ago. So it's come into Thai culture and songs from when? 100, 200 years ago? Or?
Yeah, from the journal that we could trade have been in the initial of the Jackie dynasty, that means this dynasty, so about 200 years. And also they have been traded might be from the Portugal that have been traveled by ship and go to Sri Lanka and Malacca Island. That's why when they come to Thailand, we call Malacca. It's from Malacca Island, from Malaysia. So that's a story that we can share.
Okay, thank you. Okay, Tomoko first, I will next.
I'm Tomiko Yamaguchi from Tsukuba, Japan. I understood that there is a committee within Thailand which gives final approval to the commercialization of transgenic crops. My question is, which government authority is in charge of that committee? Who heads? I mean, who are the chairperson of the committee? Which government authority is he from? For instance, is he from Ministry of Agriculture or Ministry of Environment or other department? Thank you.
Okay, I think our biosafety protocol this way. We start from the institutional biosafety committee. When you want to do something with the genetic engineering thing, you must submit to the IBC, and from IBC approved by NBC, National Biosafety Committee, and from that will be step by step from the greenhouse to the small field to the big field, and after that the data collected from that all the location will be submitted to the Ministry of Agriculture, and in fact by the law Ministry of Agriculture can approve to grow the GM or not grow the GM right away. But on the same side, Ministry of Agriculture not do that. They will throw to the Prime Minister and ask Prime Minister, we should do this or not. So that will take a while to, get the agreement. It will grow or not. I speak on the. You can see we have the first cases on the BT cotton that have been studied at least 5 years ago, and scientific evidence show okay to go in the field zone, but government still not make decision that we want to grow or not. And even now the policy is still on the Thailand not GM country. It's still on. Okay.
In producing the transgenic papaya, you have arrived at biosafety standards, like in drug preparations, pharmaceutical drugs, best before use, such and such a date, expiring, then the negative effect starts. Have you determined that in transgenic papayas, they are best before use on such and such a date, and it will start giving negative effects after such and such a date? Is there any such calculation that you have read?
As I mentioned before, that our standard will be follow the international standard, and food will be, in my viewpoint, food is food. It must be safe. It must to determine everything that it really safe at the old papaya. And by new technology, we can prove that. For example, you can see the expression of the protein in the proteomics view. You can look on the medicine and also testing on the animal, everything. I think we will do the same thing as the FDA do with the drug before we send out to be sold in the market. That's my point that I will try to tell the people. We just need more evidence, more scientific evidence. Don't just hear the people talk and say GM is a Frankenstein, GM is a bad, is a goat, is a something. I think we pass that viewpoint. I think in Europe 10 years ago, And if it show today at Dr. Bahon show, that means what is meaning? I think if you compare these two pictures in European country 10 years ago and the same picture that they come into and have torn out our papaya, it's the same picture, same wearing the suit, space suit. That means what that means in the term of technology, in the term of education, in the term of living things, in the term of many things you can compare by one picture. I think you can make your mind. I think.
Okay, now sit down, please. We have I want to tell you a list of people who have to ask questions. It's very unpopular question time. And so please make questions and answers brief, then we can have more interaction. I have around Mina, Irene, Sophia, Elise, Alan, Dr. Gadani. So who? So maybe if you don't mind, I'll follow that order. That's the order that I noticed people. So I have Mina first, and then Irene, who's second on my list. Yeah. The mic over there. The mic goes there. Mina, please. The mic, the second person is there. Irene, thank you.
After
Mina
I
next.
finish.
Yeah.
All right.
So Mina, you go first. Yeah.
I have a philosophical question because there was a sentence that said scientific evidences for public concern, and that's very intimidating because the concerns that public might have may not be scientific at all, and majority of lay people don't know the scientific details of what the scientists do in the laboratories anyway. So, and then it leads to another further problem of your responsibility as a person who knows what's going on, because one of the two previous speakers said it's not our responsibility, and I'm quoting the first two speakers, they very clearly mentioned it's not our responsibility. Then whose responsibility is to tell people? And secondly, was there any public debate held before experimentation was done, so that you don't have those public concerns at all?
You bring a good point to say that when we get started, we didn't have public concern at all. I think it's true. But many things in the world, facing people build a plane, need to ask public or not. People build a car, need to ask the public or not. You want a car, never have someone ask you. So I think that's the point that I like to say that. That's why we need to prove that the thing that we do is good or bad, and let the people think. You see, you know that you ride a car, you have a risk. Same thing. The car will hit, bang, and everything dead. Why you still ride a car?
Okay, I'll keep to the order, please. Thank you, Irene.
Can I give just a quick response to that concern? Well, this story is quite different. Well, like I said before, that the story started in the US, and the project of the transgenic papaya was prompted from the farmers themselves. They came together as the Papaya Growing Association, and they went to the University of Hawaii, where most of the research was done, to ask for any control measure to control this virus, because of this devastation was so badly that had changed the people's lifestyle. They have to change the job, right? From growing as being the farmers, they have to change to be taxi driver for the tourists and so on. I mean, this really affects the people's life over there. Okay, and for the Thailand standpoint, because like previous presenters have said that most of the people who grow papaya here mostly are villagers. Okay, they just grow in the backyard. The problem is there, but perhaps we have not heard their voice. That's the main problem. However, but like all of us in the morning session have said that the virus disease has no cure, especially in the plant. And since we have the solution, even though it's not a silver bullet, but it's another solution that we can provide as a choice for the farmers to choose. Well,
Okay, thank you. Irene?
Morning, I'm Irene Tafaki. I live in the Marshall Islands in the Central Pacific Ocean, where we have our own papaya, and we also have imported papaya, and the joke is that you don't throw anything out with the imported papaya because you don't get any, you can't grow. We're used to throwing our papaya seeds out, and we can't throw the Hawaiian seeds out because we don't get little papayas out of them. So maybe this is a naive question, but it's about the seeds, and when the papayas, when you want to propagate, how does a person in the rural area get an opportunity to plant the papayas with the transgenic papayas, or can they do it and can they afford it?
At the moment, Thailand has not allowed any transgenic plants to be grown outside of the research field at all. It's prohibited. But if you ask in the standpoint of the Hawaiian story, well, the farmers have all their rights to breed, to make their own cultivars from their transgenic that the Papaya agency provide. They have all the rights because, like I said, that this project was started as a request by the farmers.
I just would like to ask.
However, the transgenic papaya can only be grown in Hawaii officially.
We have one of the participants, an expert in plant biotechnology. Kaiser, could you, do you know something more about the background, and you could explain simply the process of these seeds growing?
Thanks for giving my time. My name is Kazuo Watanabe at the University of Tsukuba. I've been involved in the first phase of technology transfer of PRSP from Kone to Thailand. And also I was working on the international organization. So I have some of the holistic pictures of what's happening in Thailand. So the one thing, a short the question on the public perception issue. You have government policy and also the participatory documentation prepared by the Science and Technology Agency. Dr. Nares is the one person making the public the materials, even for children can understand easily on what is biotech, including the GM things. So actually you are kind of advanced the country in terms of making public communication materials. Your materials are actually copied from Thai to English and the European language to be used in European community. So that one complementation. Actually you have like a group approach, scientists working on specific aspects, and those are public communicators are making to explain. So, and also going back to the public perception survey in 1990s as a beginning, when the Europeans and the US started research, we also had a survey by the outside and also in country. Here the public perception in the biotechnology is relatively high compared with other countries. Maybe the way on how to take fear is different. So the starting point in your public is rather neutral or considering. And now you have more the public understanding information coming from the governmental sources. And also the specific question coming on the safety issues are both on the environmental biosafety and the food biosafety, generally on the cold protein technology. Those are common technology. They are tested more than 15 years. the potatoes and the squash, and nothing happened. It's a problem to be saved on the environmental biosafety. And there are a lot of studies done and reported in the scientific journal on the presence, absence of transcapsulation and the side effect of horizontal transfer. No. So it is safe in terms of the adverse effect to the environment. No the high risk. And the food safety issue, it is consumed the same the cold protein technology used in different crops, and it is commercially available. And you have a good monitoring system developed by government and also international standard of food safety, and you are following. Thailand is a good example, having the national framework and also the institutional framework, and you adjust the biosafety in terms of environmental biosafety with the protocol. You pick up the Annex 2 of the biosafety protocol to the example and specify into the Papaya case. Everything is well examined. Actually, you have also feedback system. So you explain the case on the Papaya, but actually my understanding is that Thailand is one of the countries well considering the biosafety issues. And the one more, the IPR issues on the PRSB. So many components are actually free and donated, providing that your country use the PRSB cold protein technology to be used in your domestic varieties for domestic consumption. So to make a transgenic papaya, the variety, probably 20 to 30 major patents are required. And many components are made as free for domestic use. So actually to develop the transgenic in this country, government sectors had quite a lot of inspection on if technology proper, IPR okay, safety issues okay. So I think that it is a good way to make the approach in terms of how it is well examined before you implement, including the ESCAP component if it is not. Because the outside owners on the technology also they examine if it has the values for the subsistence farmers. So my understanding, particularly to PRSP on Papaya, I think you have a good development going on. Thank you very much.
Kasia, can you answer Irene's point about why the seeds from Hawaiian papayas would not germinate in the Marshall Islands? Can you pass to Sophia first? Sorry.
I have one question.
Okay, go ahead. Yeah.
What is major medical usage of papaya?
The major usage?
Major medical usage of papaya.
Someone answer. Yes, you can answer. Come to the microphone, please. Yeah. Parachat, please.
Is papain. Okay, and sorry, could I ask one thing? Maybe it's misunderstanding. I never say it's not our responsibility. I said it is our responsibility to give people some knowledge and understanding about scientific point of view in our world. Thank you very much.
Thank you. Okay. So Sophia, please.
Okay. The papain is good. As it's mentioned, it's for digestive system, and you got tummy ache in order to take it. And also some people say that it's good for overall sort of thing as well, but that's not scientifically proved, so I could say, but for your tummy ache, yes, it is. And also for the lot of industry, for example, to make the meat and all that tender, they soften the sort of things.
Okay, thank you.
Which is that papaya is rich in beta-carotene, which has been shown to have anti-cancer property.
Okay, thank you.
I'm Sunya Sufiam from Thailand. But anyway, the gentleman before just answered some part of the thing that you asked already, because as I'm Thai, I heard that in Thailand we did the GM for the potato too, right? No? That they used to produce lay
As my knowledge, no one works on potato
No one
in Thailand.
for the GM, right? So only the papaya. And then when you talk about the food safety, I just worry because most of the Thai people we eat papaya almost every day. So in case in the future, if your research is work and then proved by the scientific that is no harm for the people, and then what about the farmers if they're going to get the plant free, or who is going to control the price of the GM papaya plant?
I can answer on behalf of Kasetsat because the GM papaya in Thailand have three group work on this subject. One is from DOA, one from Mahidol University, and one from Kasetsat. In Kasetsat University, we are the public funding, so everything will be go out free of charge. That's our thing that have been long-term thinking about this, because we working on this subject since 1975, as I mentioned before. That's why I mentioned that this is the real trouble of Thai farmers, and we not really look for that. Even we can solve this disease. We think the amount of production of the papaya still for the local consumption still not enough, and we really want our society come back, not grow the papaya in the deforestation places, back to grow along the side road. You can, in the past, you can say, when we go to Nakhon Pathom, this area, this is the papaya country, but now you never see papaya plantation. That's the thing I hope that if this technology can be proved that it's good, it's safe, Nakhon Pathom will be back to the papaya land. Thank you.
I'm quite worried that you said you worry that the papaya that you have been eating every day is GM. Right? Of course not. But well, then I just want to ask back, what do you worry about? What concerns do you have?
I think let's consider concerns of food at lunchtime. I hope we have some papaya. Next is Elise, please. Okay, we have I think after Elise we have Alan and Zhang, and that's all the questions we have time for. Okay.
Elise from University of South Pacific, based in Fiji. Just a quick question. Could you give us in some specific detail who owns the papaya industry in Hawaii? Because you mentioned that it was the second largest agricultural export. Since after pineapple is mainly owned by large US corporations. So I'm curious to see if the papaya industry is the same. And also, could you give us the number of actual individual farmers involved in growing papaya? Thanks.
Okay, as for pineapple, I think it's well known that Dole is the company that monopolizes the pineapple production in Hawaii. But in the case of papaya, up to my knowledge, there is no single private company as the monopoly market. Papaya grown on the Hawaii Island are from the small farmers. Okay, and when they want to sell, usually they come together as a corporation or organization, and then they have the quality control to check whether it's transgenic, non-transgenic, just for marketing purposes, and they put a label on it.
Okay, Alan.
In your discussion, you mentioned that you do contained field work, and I would like to get a better understanding of what you mean by containment if it is an open field. To me, it seems a conflict.
Well, in my pictures, right, I have shown one picture with open field, but I say that it's contained field conditions. Well, before we reached that state, we have done the greenhouse experiment. The greenhouse experiment, well, I'm talking on behalf of the Department of Agriculture, as I'm also part of that project. As for the contained field conditions, well, we base this definition on the scientific research that the pollens of the papaya do not fly over 15-meter distance. I'm not sure about the exact number, but this is what it is. And we have double gate, we have double fence, and we have 24 hours guard looking after the experiment field. Okay, and well, just to compare to the Hawaiian situation, okay, the contained field experiment that they have, well, they have actually grown transgenic and non-transgenic papaya just perhaps 10 meters apart. Okay, perhaps with a mold of soil in the middle, and that's it. But because of the chance, okay, when we talk about the risk, you have to talk about the probability and the hazard that might happen. So now when you talk into the term of probability, then now it goes into the, let's say, random checking, and how often you have to check and how random, and that can be used to confirm or set the standard.
Thank you. Sort of last question, comment, Sam, please. Use the microphone. Use the microphone, please. It's the last question, then we'll have the next paper.
I'd like to ask you a very simple questions. I like Thai food very much. For example, the durian and mango. But is it the best seed of the papaya now you are growing? Is my question. It is the best seed because every fruits here I have, and every time I come to Thailand I already have the durian and other fruits that I think that is the best thing compared with the fruits in Vietnam. So why, my question is why you brought the seed from Hawaii but not the another? Because I'm not sure that my taste is maybe different, but the seed of the papaya in southern part of Vietnam I feel is better, but it is first question. And the second is, now I saw in the Emporium supermarket, there are strawberry and it's called, written the sweet apple, but I think that that fruits have a different name. It's, I forgot the name, but it's the words like the head that you have in Thailand, but it's written in the package of the food is a sweet apple. I saw it's big, very, very big in compared with the natural. So is it GM strawberry and GM sweet apple?
No, I can say absolutely no, because we didn't have anyone do on my case the sweet apple, which like each one a kilogram. That in fact we call guava and guava. Q-U-A-V-A.
No, guava.
Yeah, guava.
Not guava, sweet apple, not guava.
Apple. Not apple. Apple, we didn't go apple in Thailand.
I believe that, well, most of the fruit, if you have gone to Emporium, most of the fruits are imported. Okay, and but if you have been to Japan, Taiwan, or even China, they have very large fruits. I have seen a strawberry in Japan as large as an orange.
It's bigger than Japanese strawberry many times.
Yeah, I think you went to the high society shop.
Okay, well, thank you very much for the two lectures and the active discussion. We will have to move on. And we're going to have a slight change in order because Don is going to have to catch up. Going to have to leave us soon after this talk. So he's going to talk first, and then I would like Kunvoralik to talk after that. Lunch will be delayed, and then I'd like to ask Alan to talk this afternoon when we come back, because the schedule for field visit, we have one talk missing from this afternoon, so that will give us 4 talks in the afternoon. And in fact, our field trip will not be so long because of the unless you want to go swimming. Okay. So, Tom, please.
Thank you. Can I please acknowledge the talks from our colleagues from Kampang Sayan University? That was extremely informative, and thank you very much. I think the paper which I will give perhaps is a natural flow on from some of the questions which have been asked. Australia has introduced a very strict system of regulation for genetically modified organisms, and the question which we are now working with, and I'd be very interested for comments, and if anyone wants to make a contribution, to the question of where does the ethics fit in, and where does the public fit into this very interesting science. Essentially, in 2000, Australia made a decision that it was going to move to a legislative framework. The object of the legislation was quite explicit. It was said that it had the intention of protecting health and safety and protecting the environment. Those obligations, of course, arise from some of the conventions which our colleagues from our post-university have given, where Australia is a signatory to those biodiversity conventions. And the other intention was that in dealing with GMOs, there had to be adequate risk assessment. So we came together as all of the states and territories in the Federation, and Ellen will be talking about what one of the particular states in Australia has done. And it was intended that there should be a nationally consistent policy. It should be entirely accountable and open. There should be some system of fitting in stakeholder and public views, that the assessment had to be scientific, that there had to be a great deal more independence required, and overall it was intended that there should be a central gene technology licensing system to avoid duplication with the states. What's very important, and I think it was some of the questions which were asked, the first thing that was not included was other technologies. It's not the role of the system to say, well, we could do this by some other way. Secondly, and there's been a lot of criticism of this nationally, there was no economic issues. There's nothing to do with cost-benefit analysis, because that would have been very challenging for the regulator to work out whether in fact this was against Australians' interest because it might be a foreign company coming in. One of the major reasons that that was excluded was because of the WTO regulations, which say that there should be equivalence. And finally, there was nothing to do with the marketing of trade impacts. And that, as I say, has been a subject of quite heated debate. The regulator so far has approved 35 field trials. There are also very strict rules about licensing particular organizations and also approving particular laboratories. So there's some 303 contained dealings. But there's also provision that if there is proved notifiable low-risk dealings, those are simply notified, and there's been some 1,800 of those. So far, the commercial licenses are for one variety of carnation, which is blue rather than red. Why somebody wants a blue carnation, I don't know. it seems to be very popular. Cholera vaccine, BT cotton, which there's been some discussion amongst the delegates this week, and also to canola. Most of those, of course, in the cotton and canola are arguably using less pesticides, and therefore we're reducing or improving the environment, or that is the argument. The governance framework, I know that there were some questions to our colleagues at the university here. In Australia, all the 5 major departments, that's agriculture, foreign affairs, health, education and so on, came together and set up an intergovernmental agreement, and then they established a gene technology regulator who licenses the GMOs. This is a bit complicated. Above that, the Ministerial Council operates and can lay down broad principles and receives the reports from the gene technology regulator. The major consultation bodies when there is to be a licensing are these various bodies in yellow, and I won't go through those. And then there's these 2 advisory committees. The one in the middle, the Gene Technology Ethics Committee, is the one which I chair. And there was a community consultation committee established, but that hasn't been reappointed as yet. What's this committee intended to do? Well, it was to give advice to the regulator and to the council, which oversees the entire national system, on codes of conduct, if those were needed. The background was that there had been a lot of confidence in a body which I had the great honour of serving for some 6 years, the Australian Health Ethics Committee, which drew up the guidelines for medical research. And there was a feeling that that should be duplicated. It's a multi-member committee with skills in the environmental ethics, law, religion, agriculture, and so on. And essentially these policy principles are the way in which, outside of the Act, a code of conduct or policy principle can be given, and those are binding and required to be followed by the licensee. Well, the real question is, where do these environmental ethics fit in? Because I mean ethics in a quite restricted sense. I know we've had lots of discussion this week using the expression of environmental ethics, but it's in the sense of a direction of what one ought to do, the kind of thing that one finds in a code of practice. We're very familiar with that in the medical research area. From the earliest start of the Declaration of Helsinki and the CIOMS guidelines, every country has established formal guidelines with rules about the basic principles, consent, review and so on. Similarly, animal welfare. I know some of our colleagues yesterday feel that we're not moving sufficiently quickly on animal protection, but again I think there's some prescribed rules about reduction and so on. But in the environmental protection area, we've all decided it's legislation that we look to. The legislation will set up rules about what can or cannot be done to the environment. So, for example, the Convention on Biological Diversity, which our colleagues have mentioned, and I think the UNESCO has also tried to enter into this field to make some comments. So where is the place for environmental ethics? Particularly in a highly regulated scheme such as Australia, and by the way, most of the GM countries are bringing in some kind of centralised licensing system. Well, the GTEC has taken the view that there is actually a space, and we're developing this. Why? Because we've looked around to find that there are, within the Act itself, space to develop these policy principles. Secondly, there's a great deal of international conventions which are suggesting that beyond the rules themselves, there are responsibilities of the scientists and the stakeholders to make sure that this technology is used for benefit. And I think there's some lively discussion there. Thirdly, there's no question there are still community concerns about this. In Australia, we have an organisation called Biotechnology Australia. It has done samplings every 6 months of public opinion, which shows people are massively in favour of stem cells, massively in favour of medical research, but when it comes to GM, there's still a lot of public concern. Fourthly, I think there's a lot of very fine scholars now beginning to develop from general ethical principles, environmental ethics as a distinct branch. There are already codes of practice in medicine and research ethics that can give some guidance. I think we all accept the general principle in science that there's a responsibility on scientists to act with integrity. Yet at the same time, I think there's a duty on the scientists to pursue knowledge in the public interest. So essentially what we've tried to do is draw up at the moment a draft which is going out for public consultation. I know this is very busy, but let me try to just highlight each of these dot points. The first is the statement that it's the integrity of the researchers which is the guiding principle. I believe that if we look at all of the codes, they are not based upon an assumption that we are going to try to act as policemen, to go around investigating every laboratory. The assumption must be that the integrity of the researcher is the starting point. In other words, we assume that as bioethicists or ethics committees, we approve things and then the scientist takes responsibility. If something comes along, we're not police people. What we are is the fire service. We have to go and try and put the fire out. In other words, we assume that everyone that has a house is looking after their own safety. Second, you can see that there's a very clear statement that there should be no damage to the environment. And we've also added the responsibility is beyond the limits of Australia's national jurisdiction. We're perfectly clear that we work in a scientific and internationally linked community. I don't think it's sufficient for science to say we'll only look after our own house and not our responsibilities beyond that, particularly because we know that Australian scientists are involved in overseas research projects. Thirdly, we've tried to suggest that we have, I think, with this technology more than others, a responsibility towards future generations. And I think we've already had some questions, which is realising that it's not possible to section off the science without looking at it in its social and environmental context. We've got to look at this holistically. Fourthly, you will see that there's a statement there about being conducted in a manner which integrates the environmental and health protection. Again, I think that comes from the Act, I think it comes from the nature of the science, and I think it requires us to take a holistic view. Fifthly, a very traditional dot point that you should have respect for persons, because much of this science is being driven by commercial interest which will mean that in the dealings with the farmer, and I think there's been some questions of that nature, that it may actually change the way in which the agriculture is performed. Sixthly, we've also said that there should be a demonstration of respect for all living things, because this is not anthropocentric. We're talking about a relationship with environment and other living things. Seventhly, there is obviously the requirement to minimise risks. I think that is part of all research. It's common in the animal ethics rules, it's common in the medical research ethics rules, and I think that is a very obvious thing to be repeated in such a code. Eighthly, we feel that the researchers should also be considering qualities of compassion and solidarity. We feel that that is an expression which I think has been popularised in Europe. I think it's become very popular in the UNESCO declarations, that I think we've become terribly concerned about individual rights. And if we were to look at this technology by simply saying, I have the right to pursue knowledge goals, I have the right and the commercial patent to carry out this project, I think we miss that part of, I think, the technology which operates within a social context. And I think the idea of solidarity reminds us all that there are things beyond science itself. And ninthly, we've also accepted that there ought to be some statement of a challenge to realise an equitable distribution of the benefits. I think our committee takes the view that there has been, I think, in UNESCO and many declarations dealing with world poverty and health, and let us at least say that when the Americans last night tried to get the United Nations to throw out the Millennium Goals, they did not succeed. And I'm very pleased to hear that, because I think one of the things which I think is most concerning in this technology is that it's possible it will not be held by researchers, it will not be held by governments, it will be held by private companies. And since government has traditionally had the responsibility to share benefits, will the company do this? Well, there's no reason that it has to. A company is not obliged to share except amongst its own shareholders. So we think it's very important that we think about this as a nation, and so we've added this idea of benefit sharing. And finally, I think a general comment that you shouldn't be trying to say that one of these principles is better than the other. It really is, I think, a host of rules together. Very briefly, the starting point, I think, was also to say that with ethics, we try to identify what are those values from which we will derive these ethics that will drive our conduct, the ethical conduct. And we've tried to say that we think the promotion of knowledge is a value, acting with reason, but we do think that public trust is becoming more and more important, I think, because so much of this kind of science is not being conducted publicly. It is not necessarily going to be published in the open public forums of referee journals. So therefore I think there is the correlative responsibility of those dealing with GMOs to ensure this element of trust. The integrity, I think, of the researcher is absolutely clear, and also the courage of the researcher to stand up and let their voice be heard at times when there might be pressure. Respect for life, freedom of choice, and respect for the environment. The next steps are that we're formally starting our public consultation on the 19th, and if you're at all interested in making any comments or having that, I should be delighted to hear from you. So thank you very much indeed.
Thank you. So I'd like to have specific questions on the Australian framework and outlook, please.
When you were raising the question of the need for having environmental ethics, because we already have, I mean, there's a distinct branch or subject field, but we already have animal welfare or other branches. Now, I would just like to raise a point, like when you are trying to protect the integrity of of the ecosystem, or even at a larger landscape level, at the macro system level, can you really look after the integrity of these systems, macro systems, without having a distinct environmental ethics? And also, if so, how could we really develop it, where even the non-living components are included in the ethical framework?
I think it's a far better question than anything I can say in reply. I would prefer to take that as a comment. I think what the environmental ethics and what I think our committee is trying to do is to make a very modest start. I think the concerns that we've already had during our debates about pollution, about Morgan's description, I think, in our foot on Monday morning about the entire biosphere, I think we're just making a rather modest start. And I think what I think good science is telling us, it's always going to be interlinked. And all that we're doing is trying to push, I think, the envelope a little bit further. I think you're saying we need to go further still. Thank you.
Thank you. Yes, please.
Hello, my name is Chan from Thailand. Can you clarify your last point about the public trust? Because I think it's a problem in this country. On my personal opinion, GMO is not that much terrible. But I think one of the greatest concerns of the Thai people is the public trust, because there are so many things that people in authority, like the government, say something, but at the end, it's not something that they said. How about like the private corporation? Certainly, we are reluctant to trust them. But in case, for example, in Thailand, when we find that it's okay, it's safe and it's acceptable, and how can we communicate to the people and to make them trust? Because in the past, that they have difficulty to trust all this authority. And in your experience, in your government, what do you do?
Thank you for your question. I think there is lots of evidence. For example, if we take the United Kingdom House of Lords report on science 3 years ago, that was a report which used, and I quote, "The advance of science has been marked by deficits of trust." I think in our own country, Biotechnology Australia has done lots of survey work which shows that the minute a commercial private interest is involved, people's trust descends. So I think there's a large amount of data which is showing that the community is becoming more sceptical. I think the other thing which is causing some concern, apart from the commercialisation of science and the information not being made public, I think the second thing is companies are not subject to the freedom of information legislation which many countries have. So it means that it's not possible to get the full story. Thirdly, government is now coming in, as with universities, which are entirely independent, into relationships and are actually having agreements in some cases with a company which says that the government will keep the information confidential, which always strikes me as a slightly unusual thing for governments. I have a very old-fashioned view about government. So if that is the problem, then I think it's something which has to be addressed. And I think it's the responsibilities of all that are involved, and I think the gene technology regulator takes the view that public trust is something which is in the public interest and ought to be addressed. So, thank you for supporting.
Okay, thank you. Okay, I'll move on.
To combine it with health, in that regard, I would like to go back to this genetically modified papaya. In India, we eat papaya as a raw, before it becomes ripe, as a raw vegetable, because it's good for health. And we also eat it as a ripe fruit because it increases the hemoglobin content. I don't know whether it is true, but people rather believe that it increases the hemoglobin content. And if people want to abort a fetus, in rural areas especially, they take papaya every day, morning, afternoon, night, fruit, so that automatically, naturally, the abortion process will start. This is a widespread belief and a practice in rural India. I'm sure most of my friends who are assembled here, they know what I'm saying is true. In that case, if there is going to be a genetically modified papaya, will it stop bleeding or will it continue to increase the bleeding in women, which is a natural process when they want to abort a fetus? That is the concern we have when we are talking about genetically modified papaya. In that regard, will you be able to answer the gene technology ethics and the health? And my second will be, you were mentioning that in Australia, it is possible to legislate about biological diversity and to overcome the problems of biological diversity being endangered. But in India, legislation causes all the problems. And most of my friends here who are assembled, they will know that the latest Biological Diversity Act of 2002 and the Biological Diversity Rules of 2004, published only in March, they deal with only foreigners are prohibited from exploiting our biodiversity. Local people can exploit. That is the irony. So we cannot do anything by mere legislation in our country. You have to convert the legislative acts into educative programs and environmental ethics programs. That is what I have in mind. Would you like to respond?
I don't know how to respond. The first thing I would say about the use of papayas and the multifacient, which I never knew about, seems to me the kind of question which an ethics committee would find very interesting. The second, does legislation work? I feel I should impose on our chair, who probably wants me to finish, and tell you a little story that Australia really is one of those countries, I think because it's had such a large influx of population, has tended to look at legislation. It's also a country which really did set up one of the strongest welfare states ever. So it really always looks to legislation. So I could tell you a little story. Recently UNESCO, and this is Thailand, this is so appropriate, had declared it's the year of the elephant. And everyone at UNESCO said, marvellous for Thailand. But what about all these countries which don't have elephants? This isn't fair. I don't know if our colleague from Germany is here, but the Germans said, oh, we would like to do something. I know what we'll do. We'll have elephants and efficiency. And we'll have a day, seminar. The French, comme d'habitude, have decided that they would have something philosophical. Elephants and existentialism. The English didn't want to be left out. And as Amir pointed out, Australia has just lost the Ashes. They decided to have elephants for tea and tiffin. Australia, on the other hand, and Ellen is going to come up shortly to show you how it works, they decided that they should become involved, but they decided to set up an intergovernmental committee consisting of intergovernment experts to work up a working paper and a public consultation document. After 4 years, they eventually set up a report which was Elephants, Federal or State Responsibilities. Now, I know that I haven't answered your question, but I think the audience enjoyed my answer far better than the proper answer. I've completely run out of time, and I can feel my chairman wants to shoot me now.
We wanted to have, and it's a great, we have to say farewell to you and push you all to the airport. Good luck. And we enjoyed your stories very much. Well, thank you very much, Don. It's a very good overview.
Thank you. It was a great pleasure attending. Thank you.
Thank you. So thank you. So now we're going to change to indigenous chickens, not elephants. Okay. And so the next presenter is Boravit Sirpora from Thailand. She's going to talk about description of Thai indigenous chicken plumage, colour, and broodiness using classical and molecular genetics. And this is important to listen carefully so that you'll understand when you go to the laboratories in the institute to visit the chickens this afternoon. Thank you.
Yeah, thank you, Mr. Chairman, distinguished guests and ladies and gentlemen. My presentation is description of Thai indigenous chicken, plumage, color, and broodiness using classical molecular genetics. Thai indigenous chicken is very important, not only for the protein source, but also for the entertainment in the rural area. That you can find the backyard chicken in everywhere, but right now it may be hard to see because, as you know, that Thailand has encountered with the bird flu. This one is the backyard chicken. That's you fly everywhere. This one is for entertainment. That's we call sport. This one is not we just for the entertain. That the Thai native chicken is very strong for fighting and very careful. They have many styles of fighting. Most scholars believe that the ancestor of Thai indigenous chicken is also the red jungle fowl. That's which are still exist in the highland forest, especially in the northern part and northeastern parts. This one is the typical down color of the red jungle fowl. It should have the two styles. Wow. This one is the they had newly hatched. When this go up, this one the typical plumage color of the red jungle fowl. That it should have the same with a little bit blue or green. That's why controlled by the genetic. And the plumage color is controlled by the genetic too. More of the Thai indigenous chicken manifest the woody behavior. That is the most important trait in rural area, where no artificial incubation is available. So the hen is naturally brood their egg to produce their own chick. This one, the egg, that's the everyday they will lay. After that, they will become broody, the egg. The onset of chicken incubation is started by an increased plasma prolactin. The science prolactin said to induce incubation behavior is the hypothalamus. Gene encoding the prolactin receptor is also active in the hypothalamus. These two loci, prolactin and prolactin receptor gene, were selected as a candidate gene in this study for the woodiness because it plays a critical role related to trigger at the onset of incubation. It is well documented that the most striking colorful feather of chicken is controlled by more than 40 loci, given a lot of pattern of plumage color. If in the mouth is more than 100 loci, that's concerned. This one is our backyard chicken. You will see a beautiful color of them. This is also another one kind. Thus, the final phenotype of plumage color is not only effect of the additive gene, but also the effect of dominant and epitaxial gene. The major pigment responsible for the variation in the plumage color is melanin, including two components, eumelanin and pheomelanin. Eumelanin gives a black or dark brown, while the pheomelanin causes a less buff pigment. The major locus responsible for back plumage is extinction back locus. A multiple allele exhibiting different feather color have the order of dominated as extinction locus, bird chain, dominant western, white Thai. This one, the red jungle fowl should have this gene, and buttercup, so on. The possible genotype of the white Thai chicken or red jungle fowl are E plus E plus or EB. This or genotype that should be the genotype of red jungle fowl. The other gene loci control the plumage color are include melanotic genes. This gene is the extension the back in the feather and eumelanizing factor. Columbians, mahogany, dark brown, and dilute are eumelanin restriction factor. This one to reduce the melanin in the feather. And another one, that's dominant white. Dominant white, recessive white, blue, pattern gene or pencil. This one is the second pattern of the chicken feather. Settling bar, settling silver. These two is located in the sex chromosome. That we use them for sexing their own chick. We can use them. The commercial later also use this one, this gene to sexing their own chick. The Thai indigenous chicken strain were tentatively named according to its plumage color, such as เหลืองหางขาวประดูหางดำเขียวไข่กาลายดอกหมากเทาชีis the white one we call cheese ไก่ลายเบตง is only our native chicken that's stick on the southern part of Thailand. That's Yala province. We have a town called Betong, so we use this name for this chicken. This chicken have the prominent one. They have no district, no main feather, no main tail feather.